Go ahead, Paul.
Thanks, Andy, and good afternoon, everyone. Again, I'm Paul Bolin, Senior Vice President and Chief Human Resources Officer with Northern Light Health. Just wanted to point out some of the continued community partnerships that Northern Light Health and other healthcare organizations around the country are finding with new community partners for supply chain. Intention in Herman is one of those partners that has stepped up to partner with Northern Light Health in the fabrication of medical grade procedural masks, not to be confused with the N95 respirators, which are used in the direct care of COVID patients. But these masks that are used by healthcare workers throughout the facility for non-COVID, non-aspirating treatment are really a lifeline to continued personal protective equipment, and partners like Intention are emerging throughout the country, and we wanted to note that is a great relationship here, right in our own backyard, and we continue to see interest and need for additional masking, not in the healthcare work environment, but out in the community. And so consistent with CDC recommendations, people are encouraged to provide a face covering, a scarf, a bandana, a cloth mask when out in the community. And so we can still continue to see interest and support for those quilters and others who are fabricating masks at home and for themselves and family members. So that's an ongoing community initiative that we continue to see, and is certainly needed at this time.
Thank you, Paul. So I want to give a couple of highlight numbers. Currently, Northern Light Health across our system have 13 confirmed cases of individuals who we are caring for. 3 of them are at Eastern Maine Medical Center, 1 is at Mercy Hospital, and the remaining 9 are at, being cared for by our home care and hospice workers at the individuals' homes. Currently, we have 11 patients across our system who are hospitalized who are under investigation for COVID-19, and we hope all those tests come back negative. So far to date, Northern Light Lab has tested 4,256 individuals, with 131 of those testing positive. When announcing her 4-phase plan yesterday, the governor mentioned that in phase 1, healthcare organizations will begin resuming provider healthcare services that have been delayed due to COVID-19. We support that decision, and we know that this needs to be done in a phased-in plan across our healthcare facilities, as it is being done across the economic spectrum for the state of Maine. We want to make sure that we continue to provide adequate and safe care for both our healthcare workers and for those patients and visitors that come into our facilities. With that in mind, we are currently requesting that patients and visitors wear face coverings when they enter our facilities, and as of Friday morning, we will require that to be done. We encourage you to bring your own cloth face covering to our facility, and that will help expedite the process of getting into our facilities, and that's across the spectrum of Northern Light Health. We are also going to ensure that we have adequate testing supplies in order to be able to test individuals prior to doing elective or semi-elective procedures that would put our healthcare workers and our patients at risk, and so we want to minimize that risk by testing people as adequately as possible. We do know that we continue to have challenges with testing the number of individuals that we would like to test, but we do feel we can provide that service for the people who we absolutely need to test, and so we will continue to do that. We will continue to restrict visitation, and each member organization across the health system has their own visitation policy, and it's advisable that you check with that member organization prior to visiting one of our healthcare facilities. We don't have an exact timeline as to how we will go about bringing each of these services online, and we will continue to remain in contact with our patients, the public, and utilizing the media where appropriate to make those announcements. So please stay tuned, but we do expect that at least initially we will be able to provide services to those individuals who we have pushed some of their testing and some of their procedures out, knowing that it was safe to do so, but also recognizing that the longer we wait, the more that it may be challenging to get those procedures done, and we want to make sure that we do that. At the same time, I want to continue to encourage those individuals who need health care to seek health care. So if you have any emergent conditions, please call 911. And if you have chronic health care conditions or acute care conditions that you have concerns about, please reach out to your providers. Remember that Northern Light Health has many safe opportunities for individuals to interact with their healthcare providers, including safely coming to our facilities and then using one of our telehealth services. And so I encourage you to do that. And with that, we'll open it up for questions.
Okay, so the order for questions today will be Portland Press Herald, ABC 7, Penobscot Bay Press, WABI, Bangor Daily News, and News Center, Maine. I'll call on each media organization and then I'll unmute you. You'll have a chance to ask 2 questions. And if time permits, we may be able to take additional questions at the end. If your question's directed at Paul or Dr. Jarvis, let us know beforehand and make sure to get them zoomed in as quickly as possible. So with that, let's begin. First question is yours, Joel Oliver.
Yes, hi. Thanks for taking my questions. Just whoever feels like they can answer this will be fine. Can you give us some idea of, I know you said things that have been delayed will be some of the first procedures to be reopened. Can you at least give some examples of some of the healthcare services that will be reopened? Are we talking elective surgeries? Are we talking, as you mentioned, testing, like what types of testing? If you could just give some more details about that. And then my second question is, I heard you talking about testing people who come in. Do you mean like people who are coming in for elective surgeries will be tested first for COVID, or could you explain what you meant by that?
Sure. So I'll answer the first question, which was what type of services do we think will be started up sooner rather than later? And the best example I can give of that would be surveillance screening for, say, individuals who are being treated for certain cancers, where we have felt that it was safe for us to delay getting a repeat CAT scan or something along those lines. And now feeling that we have the ability to ensure safety and being able to bring those individuals in a safe fashion to get that kind of surveillance kind of testing done. In addition, we would say the same thing about certain procedures. So if we felt that we could delay a biopsy or a certain kind of surgery for a period of time, we did that in the interest of public safety, but now feel that we have the ability to make sure and ensure that we are providing safe care for both our patients and our healthcare workers. And so those would be the kind of things that we will be starting off with. And again, all of those will be addressed on a case-by-case basis. Second question was about the kind of testing that we would need to do in order to ensure that safety when it comes to COVID-19. And that would be that right now we are testing certain individuals who are undergoing particular procedures that generate that aerosolized particles that may be infectious to other people. And so we would continue that process and expand it as we expand out the kind of procedures that we will be entering into. For those truly elective, and when I say elective from a clinical standpoint, those will continue to be delayed as we assess both the safety of having larger numbers within our facilities and being able to test those patients prior to being able to do those procedures. And that would be things, like hip replacements or other things that, while are necessary, can be delayed safely for somebody's long-term health.
Okay, next we have ABC 7, Fox 22. TJ, go ahead.
Thank you. Dr. Jarvis, several weeks ago there were predictions and projections about what you would be dealing with as you went along through those several weeks that we've just gone through. I'm not trying to be convoluted. My question is, how surprised are you at what we have today compared with what the projections were?
So the question is how surprised am I by what our actual numbers of cases are versus what the initial projections were? So I will say that I was one of those people that when looking at both China and Italy's data expected us to see far more cases. But that was also prior to the governor's stay-at-home order, as well as our social distancing as a community. And I will say that Mainers did a fantastic job. The reason why our curve is flattened is because of the great work that everyone has done to protect themselves and, more importantly, to protect the community at large. And that is incredibly important that we continue to do that. So even as we open up hairdressers and other businesses as the governor phases those in, it is not the time for us to let up. In fact, it is the time for us to be much more engaged in the process of keeping each other safe. That's why the governor recommended and is going to require face coverings when out in public and you cannot maintain social distancing, and that all new businesses that are opening up must have the ability to have social distancing within the confines of their enterprise. That is extremely important, and that's the reason why our curve is flat. I will remind people, though, that as we flatten the curve, we extend the curve. And so if we were not to have put any of those things in places, we would have seen a larger number of infected people. We would have seen far more people hospitalized and, unfortunately, more deaths. But what we will see, because we did such a good job, is that the tail end of this epidemic will probably be longer, but it'll be longer with less people having severe illness and certainly less deaths, and that's important. We do not want to see a second surge, and the only way for us to prevent that second surge is to keep doing the things that we are doing now. Thank you for the questions.
Okay, next we have Penobscot Bay Press. Leslie.
Sorry, I had to unmute my microphone. I'm not sure who this question is directed to, but I'm wondering, what are you hearing from the state about testing?
Leslie, I'm not quite sure what you mean by that question.
Well, is the state asking you to do anything in order to be able to test more people? Is the state making, are they communicating with you about the availability of tests?
So the question is are we, I think the test is more, are we coordinating with the state regarding testing for COVID-19? And the answer to that is absolutely. Since the very, very beginning of this epidemic, the state has coordinated very well with the hospital systems across the state and with the independent hospitals as well. Personally, I sit on several of the state guidance committees in several of these areas and have at least one meeting every day, if not several meetings every day. Testing is usually a topic at every single one of those. And so we are coordinating our efforts. As the state has increased its ability to do testing, so have many of the private companies, including Northern Light Health, and we will continue to do that and continue to monitor. We also need to monitor what will be the most effective tests for us. So right now, the most of the tests being done in our state are direct tests. That's the nasal swab, where we're looking specifically for the virus itself. We do know that there will be a phase when we switch over to serologic testing, which is blood tests that look for specific things. There are two specific categories there. One is looking for the antigen, which is viral particles, and the other is to look for antibodies, which is the human being's own body, the mechanism it uses to protect itself from infections. Currently, there is not widespread serologic testing in the state of Maine, and its utility is questionable right now. But we continue to work with the Maine CDC as well as with our partners across the state evaluating that, and we'll continue to do so. Thank you for the question.
If I could I just follow up with one more question that's
Sure.
quite different?
Yep, go ahead.
With the staggering unemployment, are you anticipating increased numbers of uninsured patients, and how will that affect you?
I don't think we can answer that question at this time. Certainly, employment is the number one way that people get health insurance, and Paul might want to comment a little bit on that. But we are prepared, and Northern Light has always been a healthcare agency that sees the patients first and discusses monetary considerations afterwards, and we will continue to do that. We have an obligation to our communities to certainly help out people in urgent needs and emergent care. And I'll let Paul comment.
And just to tag on to what Dr. Jarvis mentioned, certainly unemployment, people who are laid off or furloughed from their jobs have different circumstances with regard to their benefits. Some employers are extending health benefits during furloughs, others are not. Anyone who loses health coverage has the option of electing COBRA coverage at their own expense. And so Displaced workers across the state and throughout the country have a number of different options. Some of them will continue to have insurance for those reasons I mentioned. Others may not, but then may then become eligible for main care or other options as well. So it really depends on the specifics. Certainly, losing employment will have an impact on benefits. But it's really too early to say what that would do in terms of the payer mix for healthcare in the state of Maine at this point, where at this point we anticipate much of the unemployment to be a short-term phenomenon as the economy is cued to start reopening as early as Friday.
Thank you.
You're welcome.
Okay, next we have WABI. WABI, the floor is yours.
I think my questions have actually been answered, so you can go ahead and move on.
Okay, so next we have Bangor Daily News, Charlie.
Yep. Hi, Dr. Jarvis and Mr. Bowen. I appreciate your time as always. I guess my questions are for Dr. Jarvis. The first one, I have one about testing in a minute, but the first one is sort of following up from Joe Waller's question about the examples of types of services that'll come back online. I was wondering, are there any types of, I guess my question is more about less kind of urgent stuff, like maybe physicals or colonoscopies. Like, do you have any sense sort of, I assume there are sort of some backlogs of people who have had that work put off and who now need to get it done, sort of how long it could take Northern Light to work through those backlogs and kind of get back to an even keel on getting people in for that stuff?
Yeah, so the question was, do we know that there's a backlog for things like screening tests, like colonoscopies, mammography, and the like, and how soon we can get through that backlog? The truthful answer is we just don't know. Those certainly will be things that we continue to delay because they are screening tests and not things that need to be done urgently. That doesn't mean that they are not important. They are important, but we also want to make sure that we are doing things in a safe and effective manner. So we'll have to continue to monitor, just like every other industry is going to monitor as they open up, what they can do in a safe way. And so really what we need to do is first take care of those people who have more urgent needs where it affects their day-to-day health. And then we will start looking at whether we can safely and conveniently open up the rest of those, including things like screening tests such as mammography or colonoscopy. Again, it will also talk about where the regional spread is of the disease. If we see one area of the state having an increase in cases as we slowly open up the economy, then that may put a pause on all of our efforts. And so we need to do this cautiously but optimistically. And then Charlie, I think you had another question?
Yeah, so this is about testing, and one of my colleagues asked it. She wanted to know, what is the specific type of test that Northern Light is doing to detect COVID-19, and do you have any sense how accurate it has been, for example, with producing false positives or false negatives, and you know the rate of false negatives if, as part of that question?
Sure. So the question is, what type of test does Northern Light Lab use, and what is its sensitivity? So the type of test that we do is called a PCR, or polymerase chain reaction test. It is a very accurate test and is the standard really for doing this kind of testing. So not just for COVID-19, but for other infectious diseases and other entities that we test for. And so it is very accurate. We have had a few cases where we wondered whether we had false negative or false positive tests, but thankfully the test that we use is a little bit different than the test the state uses, and the state has been able to validate our tests as well. There's always that chance of a false positive or a false negative. There is no 100% test out there, but we feel that ours is very accurate and believe that it is meeting our clinical needs.
some of your facilities in economic or operational distress?
Thankfully, Northern Light Health feels that we have the financial reserve and wherewithal to weather through this storm. Certainly, we are happy that the federal government has passed some legislation that will assist all healthcare agencies, but ours in particular. Currently, we have not had any required furloughs or layoffs or anything like that, and I'll let Paul talk a little bit about that when I'm done. And right now, we think that we are in a situation where we will get through this and be able to keep our entities intact. One of the benefits of working for such a large healthcare system is that we can rely on one another, and so if one of our agencies or institutions is struggling, we have the other ones to help pick them up and buffer them. At the same time, we work with those independent hospitals in and around the state to see what we can offer them in terms of assistance for whatever reason that might be. And I will tell you, it's been one of the blessings about working here in the state of Maine is how collaboratively we work together and try to keep all of us afloat and doing the things that we need to do to keep our community safe. And I'll let Paul comment further if he'd like.
Thanks, Dr. Jarvis. I totally agree in terms of the collaboration, certainly within our system as well as with other agencies and with the state government as well. Northern Light, a prime example of why Northern Light is doing some of the things that it's doing and has been able to not have layoffs or involuntary furloughs or pay cuts, I think was captioned well in a recent article regarding Northern Light Mayo Hospital in Dover-Foxcroft, talking to providers, leaders, and staff there about collaborating with colleagues throughout the system and enhancing resources that wouldn't have otherwise been available to them as an individual hospital would be weathering COVID just a few weeks prior to our merger with them. So I think really it really boils down to us leaning on each other to support one another. It's difficult work. There are oftentimes things that are changing very quickly, and certainly as we saw at the early stages of the COVID pandemic. But really it's relying on one another, supporting one another, whether it's behavioral health and other types of support, or support in the direct workplace. So all of those things I think have allowed us to weather this as well as we have. We feel certainly fortunate given the circumstances.
Dana, you have a second question?
Sure thing. What can either of you tell us about any changes in the COVID situation at Bangor's Hope House?
Dr. Jarvis?
I'm unaware of any particular changes that have been made there. I have read the reports in the media about their positive cases, and certainly we talk with Penobscot Community Health Centers, who oversees Hope House on a regular basis, and have offered our support there. But right now I don't have anything new to add than what's been reported in the news before.
Okay, and final question for today is in the chat. Joe Lawler asks, this is published for you, Dr. Jarvis. He says, I know you mentioned hip replacements as something that could be delayed further, but just to be clear, some of the joint replacements would be prioritized and could potentially get in earlier. Is that correct?
That is
correct. Let me finish. Maybe a patient who has a deteriorating condition or is in lots of pain waiting for surgery, or are almost all joint replacements going to continue to be delayed?
No, as I said, so the question was, would we delay any? Are there procedures that truly are elective that we would prioritize? And the answer to that is yes. Again, all cases will be done on a case-by-case basis, so there will not be an announcement that says we're just doing this today, and everybody who needs this done come in today. Everything will be done on a clinical basis, as we have done through this entire crisis. We evaluate patients on every day for what needs to be done urgently, emergently, and then can be done in a delayed fashion. So we will continue to do that, and you are correct. There will be some individuals who what we consider to be a more elective surgery may need to be higher up on the priority due to the person's particular condition. So yes, we will be doing that.
All right, well, that's the last question for today. So let's wrap it up there.